like teamwork, collaboration, how do we work, how we communicate, how we talk to each other. There's so much value in all those traits. But my big worry is that we're sometimes getting too distracted and too reliant upon really fully figured out tech solutions, and to me that has caused a significant distraction. And of course, I'll be happy to give some examples also as we move along.
Yeah, Dr. Nazir, it's a good point. And when you look at the areas of innovation, and from a shiny object perspective, there's always a conversation on AI and machine learning and applications of emerging things like chatbots and conversational bots. And but at the heart of it, I think there is an element of there's a genuine desire to figure out how best to apply these technologies to solve and improve the efficiencies in care delivery, because there is, I believe, from speaking with a wide variety of our clients, there is a general understanding now that the healthcare workforce has been intensely has gone through an intense period over the last couple of years. There's a lot of burnout that has happened. There's a level of appreciation of what technology could do, but hasn't really delivered on that. I'm curious to hear from you on what specific areas you think, from an efficiency perspective, if there are gaps, where can some technology can actually fill those gaps.
Yeah, I think I could name many, but I mean, just from selfish personal point of view, I mean, one thing which could really immensely help me if I am seeing patients in the post-acute settings, let's say in an assisted living senior center or a nursing home. I'm just too tired of dealing with documentation.
Mm.
I mean, what AI-based robotic systems could be in place that they could actually prepare 80% template for me based on my day-to-day practices, knowing me so well, and then gives me that good 20, 30, 40% flexibility to then customize and again have automation in that, so that with this with a mixture of dictation systems and just some point click systems, like how can within a you know minute or so I can be done with meaningful documentation. To me, I kind of always fantasize about that, and I think over the years there's been many systems that have promised things like that, but I think we're just far off from that kind of system. So that is just one example where efficiency and burnout, meaningfulness of care, all of those things will be very positively impacted.
Mm. Yeah, great point. Really interesting use case. Um, I'm not sure if you're familiar with the work that Northwell Hospital did in New York around a conversational bot they introduced during COVID, or actually in the middle of COVID, called Nora, Nora. And the goal of Nora was to essentially um, solve one element of the problem, which was constantly having to go into the system and read information just to be able to catch up on what the current state is before you're able to do anything. So one of the things they did was they essentially tried to reduce that friction, and did so by essentially automating the process of retrieving my patient information that I'm supposed to see right now, that I'm in front of right now, just through conversational bot, and even do things like alert me if a new report is available, so I actually can react to that versus having to physically go and check every single time. So things like that, I think there are some progresses happening, but they're not at scale, yet either, right? So this is like an effort that Northwell had to put in, and given the situation that they were in, to really accelerate, and these ideas came, and of course delivered. Another example of this is just scheduling, right? It's continues to be sort of a problematic area. I'm curious how you see the impact of the workforce burnout, but also the cost of that, as well as just being more efficient at scheduling. And is that an important element area, or is that it's okay, could use the help, but
Oh, it is a very, very important area, and there's reason being. I mean, scheduling is not just a scheduling function to be financially viable. I mean, scheduling, which how BrightSpring is looking at it, and how we have created, how we are trying to master our program, which is still very clunky, but scheduling really is proactive care, right? I mean,
Mm,
if you don't master the art of scheduling, then you are pretty much let at the mercy of reactivity, right? I mean, I am a clinician. I entered a facility and I'm like, all right, guys, what do you want me to do today? I don't have any schedule. I've got all my day open for you. Guess what's going to happen? Busy nurses are going to come to the clinic, to the provider and the prescriber, either it's a doctor, an NP, or PA, like, oh, Mrs. Smith fell, and that family's here. They have a question, and that's great and fine. But the problem with that approach is that you are really running the show with reactivity. And
mm,
the problem is that when you don't quit reactivity to make time for proactivity, you will never be proactive because you will always be reactive because you will have so much catch up to do every day that you will never have people to a wellness state where you can talk to them without in the context of a complaint. So that is why scheduling is important. And I always kind of teach my teams and other disciplines like IT and all that about the importance of scheduling is that it is really the difference between seeing a patient who is engaged and happy versus seeing a patient who's in pain and miserable who doesn't even want to see you, right? I mean, when people are in pain, when you're in a reactive state, they either have fallen, they have an infection, or they have fever. They don't want to talk to you. They don't want to tell you about their life, and you can't extract the real meaningful things from them because they're so focused with that misery or pain, that all that is the issue right now, that you can't get a meaningful connection with them. It is through good scheduling systems proactively.
mm,
I always say to my trainees and my colleagues, provide care when the patient is or the person is smiling.
mm.
That is a great criteria of proactivity. When they're like, yeah, weather is beautiful, I love you, this is a great place, I'm happy. That is the perfect time for us to provide good proactive care because then people will engage with you in very meaningful goals of care conversation. Like, this is what I like, this is what's important to me, all of that. So huge difference, right? But as residents and as doctors, unfortunately, I think it's changing now a little bit, but we are all trained around reactivity, right? I mean, we're all trained in hospitals mainly, and what's in hospitals? It's all reactive stuff. People in
Mm.
severe pain, one focused issue out of the whole body, so that we as residents and doctors don't even see the person as a patient. We see them as the problem. Like, hey, look at that broken leg. Hey, look at that nasty little wound, or look at that weak heart. No, this is not a weak heart. This is Mr. Smith, who has a lovely family and has these hobbies and has these goals in life. And plus, they unfortunately do also have a weak heart. Now, let's address that differently. So, I think scheduling, Rahil, is not just scheduling. It is way more than that. It is really
What,
a whole culture which we need to build around proactivity. So, that's how I see it.
what a great point and great way to summarize that. I think and, people listening, especially entrepreneurs, are thinking about what can I do and help. Uh, Tons of opportunity here. Another one that you mentioned earlier when we spoke last, you had mentioned skills management and then growing and teamwork and the challenge that exists there today, and obviously regulations are a component of that as well. How do you think about technology potentially playing a role in just understanding where a person is in their journey from a medical standpoint? There's of course there's element from scheduling as well, making sure they're actually doing the things that that they're really certified to do or are able to do well, and then understand where they're headed. Um, is there an opportunity there for technologists to come in and kind of think about that area?
Yeah, no, immensely. And again, I mean, a lot of people are actually now kind of screaming for that, is because we have given the traditional EMR a lot of chance to improve upon itself. And but other than the exception of a couple which do a reasonable job, electronic medical records have really not come to a whole new, I would say, generation, which we need them to be. Like, let me give you an example. Like, how excited I am open to open up social media, let's say, LinkedIn, Facebook, or Instagram, whatever your thing is. It's not a burden. I mean, it's some excitement with it. And during that, you learn a whole lot. Doesn't matter if you're a physician or not. You learn a lot about health, right? I mean, you learn about some educational points. Of course, many of them may not be valid, but I'm just trying to think about an environment which is appealing, right? And in that process, I learn more about my dad's health. So many times I get informed by dad not feeling well today through Facebook, right? And so to me, that is an EMR too, right? So it's an EMR which is connecting people like myself with a son, but I'm also a physician. I know that my dad's, at least one of his therapy friends is also on there, so he gets to know a little bit about one of his other physicians is on the Facebook too, where they have some personal friendship. So that's an EMR too, which is kind of very positive, where all people are looking at their own perspectives in different ways, collecting information live and responding to each other, and you have controls available. And my dad has all the controls to give me this control, that, and he does that all the time, and he does it well. So I think we have so much to learn from that positive spin to an active dynamic EMR than just a system where I have to just sit down in a boring way and, oh my God, what a drag. Do I really can I just put everything on paper? Like honestly, 90% of people I talk to, practitioner physicians, still want paper back. Like nobody's saying for, hey, I want letters back from my family. No, they love Facebook, right? But on the EMR medical side, everybody wants to go back to that paper and fax, and we're still doing faxes, right? So again, I'm not saying anything new. It's like everybody's now kind of saying, where is my next generation of electronic medical record, which will make it fun, meaningful, and easy to do my job?
Great points. Great points. Wow. There's definitely, I think EMRs, I mean, if you look at the waves of innovation, right? EMRs are sort of nearing an end of the first wave of their function. And there's certainly an opportunity for them to step up and think about this. Zoe, I know you have a couple other questions. Do you want to?
Yeah, so I've been really interested in what we've been talking about kind of like the human side of care, and providing meaningful care. So your current role is leading process innovation for health services that serve really complex populations. So can maybe you give us an example of technology or an enhancement to efficiency that you've used at BrightSpring to improve care for a very diverse set of needs?
Yeah, I mean, what we are trying to do is, again, in a clunky way, trying to listen to our frontline teams, right? And they are actually asking for things which we just do not have one solution for, right? So we actually are layering things together. So we have an EMR which we use, which is reasonable. I mean, in the current context, it's one of the better ones. But it's not enough, right? So, and to address burnout issues, whatnot, now actually we have added a layer of another extraction platform on top of it, so that in a live fashion, it actually tries to do that risk stratification of every patient and then creates that scheduling function, which Rahil, you were talking about. So we have an EMR, and based on whatever our providers, practitioners do every day, we create a log of what was done divided by what is needed to be done. So that gives us the care gaps. Like, hey, these things have been done out of the ones that needed to be done. So this patient, this member, we still need to do these things, right? So now that is our scheduling function, and then we are layering on top of everything another dictation system, and we are actually creating templates so that our practitioners can do an evidence-based documentation of their visit in a more efficient way. So again, I wish I could say there was just one system we're using it solving all those problems. At BrightSpring, we are just trying to see how can we be smart and layer on things and technologies so that people can at least kind of feel some seamlessness. But again, we're not where we need to be, and there's so much more that needs to be done. Like from BrightSpring Health Vision, we are missing very, very serious dashboards, which we're going to be working on, of course, with help of collaborators and our internal teams. And our experience is we want every provider to wake up to their impact every morning. Like there's no good feeling on a day when yesterday you did something good and that subjectively because a family member told you that, like, hey, practitioner, hey, doctor, you changed my day today. Thank you so much for helping with my pain or addressing my questions. I feel so much better thanks to you. Happens all the time. You can ask any clinician. The next day, it is the best day to go to work. You wake up, you have dreamed about it, you thought good about yourself, you felt purposeful that day, as opposed to just running around doing this meaningless check. It seems like meaningless check work. You actually did something meaningful. So what we are trying to think about is like how if every practitioner could wake up to, every nurse could wake up to, you know what, I saved these many lives this month. I saved healthcare system these many dollars. I made these many people happy. You know what? I'm going to do better. This is fun. This is why I became a clinician. So we are thinking about who could be our partners. How can we collaborate to create that kind of live impact dashboard? So that and the other thing which we want to create is really, and we're trying to do some ideas on that, is an engagement dashboard. We want to know, as a leader in a healthcare system, I want everybody's forehead to give me this digital strip of red, green, yellow of engage, how engaged I am. Because if you're not engaged, it's probably not your fault. It's probably my fault that I have given you too much to do. I'm not giving you the right tools, that you're getting burnout, whatever that may be. Or maybe you're not the right person, the right job, right? So we're really trying to think about how can we use technology to address teamwork, understanding each other better, and all of that. So I think we have so much to do on the teamwork side and engagement side, empowering people side, that we're not doing. So that's how we're trying to think.
Amazing stuff. Amazing stuff.
That is so cool.
Yeah, I think there's just too much, a lot there. I mean, my mind's already turning with the kind of ideas. So if that's happening, I'm sure there's plenty of other people listening that it's happening to as well. So don't be surprised if I share some ideas after this great conversation. Thank you for the wonderful insights. I know it's very helpful for technologists and organizations that are like ourselves, who are constantly looking to help make a difference in healthcare. Just hear directly from you and the perspective that you bring, and really appreciate your time today.
Thank you so much. I love the opportunity. Thank you.
Thank you both so much for joining us. It was great to have you on. A great discussion. So next time we're going to talk with Safi Mansour from UMass Memorial Hospital. Thank you so much for tuning in, everyone who's watching, and we'll see you next time on Health Tech Edge. Everybody take care.
Take care.
Bye-bye.